Dermatophytes are keratin-loving fungi, specially adapted to grow on hair, nails, and skin. They have septate hyphae and produce both microconidia and macroconidia. Importantly, they are transmissible from person to person. Clinically, they cause ringworm, also known as tinea. Depending on the site, these include Tinea pedis of the foot, Tinea cruris of the groin, Tinea corporis of the body, Tinea barbae of the beard, Tinea unguium of the nails, and Tinea capitis of the scalp. In Tinea capitis, endothrix invasion occurs inside the hair shaft and causes temporary hair loss, while ectothrix invasion occurs outside the hair shaft and often results in permanent hair loss. Diagnosis can be made using a potassium hydroxide preparation of scales from the advancing margin of a lesion or from hair or nail samples. Some dermatophytes fluoresce under ultraviolet light with a Wood's lamp, such as Microsporum species in hair. Treatment options include antifungals such as miconazole, clotrimazole, and griseofulvin. Looking more closely, Microsporum species usually affect hair and skin, especially in children. Their macroconidia are large, spindle-shaped, and rough-walled, while their microconidia are small and club-shaped. Microsporum autoinii causes Tinea capitis, grows slowly over 10 to 21 days, and produces terminal chlamydoconidia. Hair infected with this organism fluoresces yellow-green. Microsporum canis is associated with cats and dogs, producing abundant macroconidia with thick walls and knobbed ends. This species grows in 4 to 5 days and shows ectothrix infection. Microsporum gypsum produces many fusiform macroconidia with thin walls and rounded ends, also with ectothrix growth. Trichophyton species infect skin, hair, and nails, mostly in adults. They usually have many microconidia but few or no macroconidia, and the infected hair does not fluoresce. Trichophyton mentagrophytes is a common cause of athlete's foot and shows numerous microconidia, spiral bodies, and nodules. It is urease positive within 2 to 3 days. Trichophyton rubrum has tear-shaped microconidia aligned like birds on a wire, with colonies that show a cherry red reverse. It is urease negative. Trichophyton tensurans causes black dot ringworm, where hair breaks off at the scalp. It shows variable microconidia that can look like balloons or matchsticks. Trichophyton schonlinii causes favus, a severe form of Tinea capitis, and produces favic chandeliers that resemble deer antlers, with slow-growing waxy colonies. Trichophyton violaceum produces purple wrinkled colonies and shows hyphae with chains of chlamydoconidia. Finally, Epidermophyton floccosum affects skin and nails, particularly the feet, hands, and groin. It produces large, smooth, club-shaped macroconidia known as beaver's tails, often seen singly or in clusters, with fewer than 24 septa. It does not produce microconidia. Let's dwell further on superficial and cutaneous mycoses of the hair, skin, and nails. Dermatophytes are fungi that infect hair, skin, and nails, producing superficial and cutaneous mycoses. They are divided into 3 main genera: Microsporum, Trichophyton, and Epidermophyton. Starting with Microsporum, their microconidia are small and club-shaped, while their macroconidia are typically numerous, rough, and spindle-shaped. These organisms cause tinea, particularly in children, affecting hair and skin. One key feature is that infected hairs often fluoresce under ultraviolet light. Among species, Microsporum autoinii has rare, distorted macroconidia and terminal chlamydoconidia. Microsporum canis produces thick-walled macroconidia with knobbed ends, while Microsporum gypsum forms thin-walled macroconidia. Trichophyton species usually produce many microconidia but few macroconidia, which have thin, smooth walls. These organisms mostly infect adults, targeting hair, skin, and nails. Unlike Microsporum, Trichophyton infections do not show fluorescence under ultraviolet light. Trichophyton mentagrophytes is urece positive and has colonies with a rose-brown reverse. Trichophyton rubrum is urece negative and has colonies with a red reverse. Trichophyton tonsurans causes black dot ringworm, where broken hairs appear as black dots at the scalp. It shows balloon forms and colonies with a yellow-red reverse. Finally, Epidermophyton floccosum produces no microconidia. Its macroconidia are smooth-walled, club-shaped, and contain 2 to 4 cells. They are found singly or in clusters at the ends of hyphae. This organism infects the skin and nails, particularly the feet, hands, and groin. Let's review some superficial fungal infections. Tinea versicolor and Tinea nigra are both superficial fungal infections, but they differ in cause, clinical presentation, and microscopic findings. Tinea versicolor is caused by Malassezia furfur. Clinically, it appears as brown, scaly patches most often on the trunk, arms, and face. Under the microscope, direct preparations reveal both hyphae and yeast-like spores. The classic description is the spaghetti and meatballs appearance. One laboratory tip is that media should be overlaid with oil prior to inoculation, as this fungus requires lipids for growth. Tinea nigra, on the other hand, is caused by Phaeoanellomyces werneckii, a dematiaceous or darkly pigmented fungus. It presents as brown patches, typically on the palms of the hands. Microscopically, the colonies start off yeast-like, later becoming mold-like with age. They contain 1 to 2 clavate cells, which are club-shaped. Let's review black versus white piedra. Piedra refers to a superficial fungal infection of the hair shaft, and it occurs in 2 main forms: black piedra and white piedra. Black piedra is caused by Piedria hortai, which is a dematiaceous or darkly pigmented fungus. It appears as hard black nodules firmly attached to the hair shaft. These nodules are composed of compact fungal hyphae that encase the shaft, giving them a gritty texture. White piedra, in contrast, is caused by Microsporum bageli. It presents as white nodules on the hair shaft. Unlike the hard nodules of black piedra, these are soft in texture and are formed by white mycelia. Under the microscope, white piedra reveals arthroconidia and blastoconidia, which are characteristic forms of reproduction for this fungus.